now I think it's very apt to hear from Vandana ji. Uh, they have been doing a multiple role across the country. But when we talk about access, and especially yesterday, when in our country we heard a lot of voice that it has been third year of Ayushman Bharat, crores of people have benefiting from it, but still access remains a big challenge. And how, as a patient group, how as an organization, WeCare has been complementing the efforts along with working with hospitals, treatment centers very closely. So let's hear from Vandana ji what experience she would like to share around making this access possible, and what has been her experience around this whole subject. So Vandana ji, over to you, please.
Good evening, Prabhatji, and thank you for the opportunity given to me. First of all, I must congratulate both Sandeep, Dr. Pallavi, and Alpina ji for the great work that they've done in such a short time. We've been working for so many years, but what they've achieved in the last 15, 16 months is really fantastic because for us it was an absolutely new field where we were not even heard because we were just starting out something. And I'm glad that we were able to give our footprints to them to walk on and move ahead of us and teach us also in the process. Access to treatment is a big problem. I can give you an example of what we are doing in the adult access programs, where medicines which are extremely expensive are given to patients who cannot afford those medicines. So I would say, most of the pharma companies have access programs. Unfortunately, they are not told to the patients either by the doctors or the companies or anybody else. Some of us are able to reach out. Like, there was a person who had asked me, and I got in touch with you, Mr. Prabhat, about, how can that medicine be given? And your reaction was, but the doctor knows about it. So what? The doctor may know about it, but does he have the time or the inclination? I'm sure it's not that he doesn't want to give the medicine to the patient. It is just that it slips out of his mind. And in the process, you have a fantastic program and the patient's needs are great, but the two never match. So I think somewhere we have to do something to make this match. Make the access program available, and also to know. We have so many groups over here, and if you can talk about the various access programs in various companies for various diseases, and all of us who are working with patients are aware of those programs, I think it will reach a larger number of patients than going from the doctors. We can tell them that ask your doctor a question. We're not, like we cannot substitute what the doctor can do, but we can always tell them to ask the doctor because that is our role. Our role is to be the guide to a patient. Our role is to give them the right direction. Our role is to be with the patient during the course of his journey. And that is what we would like to do. Even in Ayushman, I mean, though it is celebrating its so many years and there is a lot of noise about it, but I don't know whether they've really sat down to understand the problem. For example, there's a medicine which costs 2 lakh rupees per month. Now, Ayushman gives only 26,000 rupees for that medicine. Now, what happens to the rest? And the patient, because he's getting that 26,000 rupees through Ayushman, is out of the access program or out of the company's program. And Ayushman will not give more than 26,000. What does he do? And then he completes that 5 lakhs in a year or 2 years. And then during that year or during the next year, if anybody else in the family falls ill or has a problem, they do not get anything from Ayushman. So I think those are the factors which maybe you as a leader can tell us all how to go about it, how to approach it, because each one of us gets busy in the work that we are doing, and also maybe we do not know how to approach the right people to get these things placed out in the right place. So I think your contribution will be really useful, and also doctors, Dr. Chitalkar, if you can work with us on this issue, because Ayushman is a big program. You've got it done for MP. How did you get it for MP? Why can it not be done for other states? Why do the people have to travel from one state to the other? The Ayushman center may be in a big hospital in a city or in a state, and the, people have to go from villages which are like 200 miles or 300 miles to go and reach the Ayushman center. Once they reach there, then the problems start because the doctors need to make them come back again for various documents, papers, all those things. All that is not told in the beginning. So, how do we make that life easier? I'm posing a question to all of you so that all of you can help me and help all of us to get better facilities for the doctor, for the patients. And that is what our role is. I know Vivek has done a tremendous amount of work for lung cancer, and now he has been able to make the medicines accessible to the patients. Also, the prices at which affordable prices. So all that has to be, understood. How can we all go about it? Everybody talks about advocacy. Why can't we as a group become advocates for the entire cancer community? Is it possible? I'm sure it is. Are we doing it? I'm not sure if we are doing it. So we need your guidance in all these things and help us to help our patients better.
Very, very important. I think, as Dr. Amol was saying, that these are some of the very important critical points, I think, that creates an action. And Dr. Chitalkar, I think when he started thinking about this, he said that this is not going to be a 45 minutes panel, Prabhat. I want to start something from today, and something which will take these efforts to the next direction. So I think what as a point, what you brought, very pertinent point, that even when we talk about crores and crores people getting access or benefit, where we can take it to the next level, where targeted therapies can be included, where daycare, apart from daycare, how it is. So there are so many questions, we all know, but we need to come together and find a way forward.